In this video, we will discuss about the investigations that we do in a patient of developmental dysplasia of hip, or commonly known as DDH. So, hip is basically a stable joint because of its cup-shaped acetabulum and femoral head, and also it is supported by one of the strongest ligament of body, that is iliofemoral ligament, and also known as the ligament of Piglow. But and so it needs high velocity trauma to dislocate a hip. But when at the time of birth or just after the birth, the hip dislocates with a very minimal uh, movement at hip, then it is known as the developmental dysplasia of hip. So earlier it was known as congenital dislocation of hip, but uh, Klissik saw that there are many hips which dislocates after just after the birth. So he gave a better term, that is developmental dysplasia of hip. So now we will see the investigations that we do in a case of development. Basically, the findings that we see in a developmental dysplasia of a patient of developmental dysplasia of hip. So before 6 months, it is XA is not of use because the ossification of the head of femur takes place at 4 to 6 month. So before 6 months, what we do is ultrasonography of hip, and the two angles are important. The method is a graph method, and those two angles are alpha and beta angle. So what is alpha angle? Alpha angle is an angle made by the baseline of ilium and the bony roof of acetabulum, and beta angle is an angle made by the baseline of ilium and the cartilaginous roof of acetabulum. So this is the baseline of ilium. This is bony roof, and this is cartilaginous roof. So normally alpha angle is more than 60 degree, while beta angle is less than 55 degree. And but in patient of developmental dysplasia of hip, alpha angle reduces with the severity, and beta angle increases with the severity. So graph categorized the severity of the developmental dysplasia of hip in basically three categories. So one is the normal, that is alpha angle, and here is it is beta angle. So one is normal, though alpha angle is more than 60 degree and beta angle is less than 55 degree. In type 2, alpha angle gets reduced, so it becomes 43 degree to 60 degree, and beta angle increases and becomes range becomes 55 degree to 77 degree. And in third category, alpha angle gets reduced, it becomes less than 43 degree, and beta angle becomes more than 77 degree. And in this frankly dislocated hip, they both are can't be measured. So this we will see in a USG picture later in this video. So after this, now we'll discuss the X-ray. So first thing, what we can do in a X-ray is we can have a von Rosen view. So in this view, the child's uh, femur is abducted, extended, and internally rotated. So in a normal patient, suppose this is a setup, this is a pelvic bone. In a normal patient, the midline through the shaft of femur crosses the acetabulum or triradiate cartilage. But in a patient of DDH, it goes away from the acetabular area. And next we can do is we can have a AP anterior posterior view of pelvis with both hip, and let's see what are the findings in AP view. So this is AP view, suppose. So we draw two lines. One line is horizontal, connecting the two triradiate cartilage, known as a Hilgel-Renus line. So horizontal line is Hilgel-Renus line, and perpendicular line is Perkins line that we draw perpendicular to the Hilgel-Renus line and passing through the margin of the acetabulum, lateral margin of the acetabulum. So this is the Perkins line. So normally the proximal femoral epiphysis lies in this quadrant, that is lower and inner quadrant. So normally it lies in a lower and inner quadrant. But in case of DDH, the head uh, lies laterally, and it is found in the upper and outer quadrant. So this is the first finding that we see in a AP view of pelvis with both hip. So next is we look at the acetabular index. So what is acetabular index? It is the angle that is made by the Hilgel-Renus line and a line that joins the triradiate cartilage and acetabular lip. So this is acetabular index. And in normal hip, it is less than less than or equal to 30 degree. But in a case of DDH, because the acetabulum becomes shallow, this angle increases. So due to the shallowness of the acetabulum, the angle increases. In case of DDH, the acetabular index is more than 30 degree. And third thing that we see in the radiograph is center edge angle. So what is center edge angle? It is angle that is made by the two line that in one that one line is perpendicular to the head of femur, and one line that joins the center of the head of femur and lateral margin of the acetabulum. So normally this angle is 20 or more than 20 degree. But in case of DDH, because the head dislocates laterally, so this angle gets reduced. So in case of DDH, it becomes less than 20 degree. And what two other findings that we have seen earlier is the position of head, that goes in upper and outer quadrant, and one is acetabular index that becomes more than 30 degree. Now we again will see all these findings in a USG and a X-ray picture respectively. So this is a USG of a normal hip, and you can see the alpha and beta angle. This is a baseline of ilium. This is alpha angle. This is, and this is beta angle. That is making angle between the baseline of ilium and the cartilaginous roof of acetabulum. But this is affected hip, uh, the left hip in which the dysplasia is present. You can see the baseline of ilium. This is beta angle that has increased significantly, and alpha angle that is reduced in this case. So alpha angle is reduced, beta angle has increased in this dysplastic hip. And this is X-ray. We draw Hilgen-Renus line first, and we'll draw the Perkins line. This is a normal hip, and you can see the femoral head is in a lower and inner quadrant. But in this left hip, the proximal femoral epiphysis goes to the upper and outer quadrant. And second thing that we can see is the acetabular index. So this is a Hilgen-Renus line. This is less than 30 degree. And here we can see if you draw the acetabular index, it is more than 30 degree. So again, it is the dysplastic hip. And third thing, what we can see in X-rays, the center edge angle. We draw a vertical line from the center of head and a line from the lateral margin of the acetabulum. We draw the center edge angle on both sides. And now you can see the angle on affected side has much reduced, and it is less than 20 degree. So in X-ray, first we saw the in a affected side, the femoral head is dislocated to upper and outer quadrant. The center edge angle has reduced, and the acetabular index has increased in affected side. Now, one more thing, uh, just to mention, the Rose-Thorn sign we see in a orthogram of a reduced hip. So, Rose-Thorn sign. This is a Rose-Thorn sign. So that we see in a orthogram of a reduced hip. So these are the basic radiological finding that we see in a patient of developmental dysplasia of hip.